Thoracic Outlet Syndrome, or TOS, refers to symptoms in the upper extremity secondary to compression of the neurovascular bundle by structures in the area just above the first rib and behind the clavicle. The neurovascular bundle consists of the brachial plexus, subclavian artery, and subclavian vein. Adson's test checks for the presence of TOS by putting the anterior and middle scalene muscles on stretch, therefore closing down the interscalene triangle, which may compress the neurovascular bundle as it passes through. Therefore, this test may reproduce the patient's symptoms. Indications for Adson's test include paresthesia, pain, weakness, and discomfort in the upper extremity fatigue with overhead activity, Raynaud's phenomenon, hand coldness and/or color changes, and neck and/or shoulder pain and occipital headache may or may not indicate TOS. There are no reported contraindications in the literature at this time. Psychometric properties are outlined here, though they may improve when combined with other provocative tests. It should be noted that some research suggests that Adson's test is of limited clinical value, as it may not adequately detect neurogenic TOS and has been shown to produce false positives in healthy controls. In order to perform Adson's test, position the patient in sitting or standing. Then palpate the radial pulse on the affected side with the patient's elbow extended. Next, have the patient rotate his or her head toward the affected side and then extend his or her neck. Instruct the patient to take a deep breath and hold for about 30 seconds while assessing the radial pulse response. A positive test includes pulse obliteration and reproduction of the patient's symptoms. A negative test includes any other results. The following is an example of a patient and therapist interaction.
Hi Britta. Hi, my name is Kelsey Stupica and I'm going to be your physical therapist today. So today we're going to do what's called the Adson's test. So the reason we're doing this is that you have a space between two muscles in your neck that nerves and blood vessels come out before they enter your arm. If that space closes down at all, it can compress those nerves and blood vessels and cause the symptoms that you've been describing in your arm. So what this test involves is I'm just going to be checking for the pulse in your wrist. I'm going to have you turn towards your affected side and lift your chin up towards the ceiling. And then from there, I'm going to have you take a nice deep breath and hold it for 30 seconds. Okay? You should feel a nice stretch in your neck, and it may reproduce some of your symptoms. But if you feel anything else, let me know, okay? Okay. I'm just going to walk behind you here. I'm just going to put my hand on your shoulder and check for your pulse. Okay? So now turn towards me and lift your chin up towards the ceiling. And take a nice deep breath and hold it. And we're going to hang out here for about 30 seconds. Okay? And what did you feel?
So I did feel some numbness along my arm.
Okay. And that combined with the fact that I did feel your pulse stop means that's a positive test.
Okay.